Antipsychotic drugs are seen as the foundation for treating schizophrenia. Their introduction has been thought to reduce the long term hospitalization. However, there are researchers that have pointed out that this reduction began before the drugs were introduced. Antipsychotics have two main groups: typical or first generation antipsychotics, FGAs, developed in the 50s, and atypical or second generation SGAs, which emerged in the 90s. SGAs were thought to be more effective than FGAs, with fewer adverse effects. However, the results of several effectiveness studies have undermined this distinction. Most now agree that the perception of second generation antipsychotics as a major breakthrough in the treatment of schizophrenia was largely a consequence of marketing by the pharmaceutical industry. There is no clear evidence that antipsychotics prevent psychosis onset, and claims for efficacy for people experiencing first or second psychosis have been questioned. Around 40% of people with the first or second episode of psychosis recover without the use of antipsychotic medication. For those with persistent symptoms, around 10 to 15% taking FGAs and around 17 to 22% of those taking SGAs experience an improvement in symptoms because of the drugs rather than placebo effect or natural recovery. Also, most of the studies have been carried out or funded by pharmaceutical companies. Trials with pharmaceutical industry support are nearly 5 times more likely to report positive results than those without, and companies have a track record of not publishing the data indicating antipsychotics are ineffective or harmful.